The number of cases of measles in Europe have reached numbers they haven't seen in about 2 decades, according to the World Health Organization. There are concerns of an outbreak right now. And let's go to Dominic Volitis, who's in London, with the details there. Good morning, Dom.
Good morning, Heather. And yes, the WHO's figures are pretty shocking. Not only are the number of infections increasing, outbreaks are lasting for longer. Let's take a look at the numbers, though. So far this year, more than 41,000 people have been infected in Europe, a figure which far exceeds the 12-month totals for every other year this decade. And of course, people have died as a result. The total number of deaths currently stands at 37. Children are, of course, among those affected, and 7 countries, including France, Greece, and Italy, have each seen more than 1,000 infections so far this year in children. But generally speaking, Heather, Ukraine has been hardest hit, with more than 23,000 adults and children affected. That's just a few hundred short of the total number of cases reported in all of Europe in 2017, and approximately 4 times the number of cases reported in all of 2016. A huge number, especially when you compare it to the latest figures for Canada, where just 19 cases of measles have been reported so far this year. Why is this happening? Well, the World Health Organization says inadequate disease surveillance and low vaccination rates are responsible. There are still fears out there, fears based on discredited research, which link the MMR vaccine, for example, to autism. In Italy, lawmakers recently voted to abolish the law that makes vaccinations mandatory for children before they start school. The World Health Organization is now calling on European countries to take action to stop the spread of the disease, which, as I say, so far this year has killed nearly 40 people. Heather.
Dominic Volitis, thank you very much. Dom in London this morning.